Hello, Dr. Deirdre Little. Great to have you. Could you tell us a bit about your research?
My interest in this topic arose from a patient. I had a young girl present to me with symptoms. She wasn't normally my patient. She came for a second opinion. She had some symptoms which were troubling her, and the investigations that I performed showed that she actually had premature menopause. It was from her questioning. She'd actually asked the question and made the possible link. Could this be Gardasil? My initial thoughts were, well, I don't think so. And I thought, well, I don't have the authority to say that. So from her questioning and from her problem, I started to research an answer for her. And I found that the research that I was seeking on its safety for rats and its safety, much more importantly, for humans, just wasn't there. There was an absence of research on egg-bearing capacity in females, in vaccinated females. And a lot of other girls have been coming and saying, my periods have become irregular, my periods have become scant since I had the Gardasil vaccination.
So what is Gardasil?
Gardasil is a vaccination that has been actually developed in Australia, and it's been introduced to all of our high school children now to prevent a sexually transmitted disease known as human papillomavirus. Look, there are 100 strains of human papillomavirus. Several of those, probably about 14, can actually cause cancer. Within the vaccine itself, there is protection against 4 strains of human papillomavirus, of which 2 of those cause cancer. So 2 of the possible 14 that can cause cancer are protected against from having the vaccine. The Therapeutic Goods Administration are responsible for Gardasil being approved for use in Australia and for use as a drug given to all of our children. So if they are taking the responsibility to authorise this drug, they also have the responsibility to be able to answer questions. And the main question is this drug safe for the fertility of my daughter?
And how is it administered?
Okay, the current program that we have is to administer 3 intramuscular injections of the HPV vaccine. Usually it's given, and in fact the program is to give it to boys and girls in high school in the junior years, so that's age 12 and 13. And they have 3 shots in a 12-month period. This is the current program. For boys, there's going to be a catch-up period. So boys will also be having it at age 14 and 15 until they catch up with girls, and they're trying to get total coverage of the population.
So Dr. Little, are there any allergic reactions to Gardasil?
So the rate of anaphylactic reactions from Gardasil vaccination per dose is 2.6 per 100,000 doses. So it's quite a good and important figure to keep in mind when we're looking at the proportional good or harm to come from Gardasil vaccination.
And have any other countries withdrawn or withheld HPV vaccinations like Gardasil?
Yes. Now, India initially introduced the program, or studies to launch the program, and they ended up withdrawing the vaccine and in fact banned it. There were 2 reasons. They had numerous adverse events reported, they were deaths that could not be accounted for, and that parents had not given informed consent for this vaccination. And that was of great concern to them, and so they banned the vaccine.
And has the Gardasil manufacturer had any other products recalled?
Yes, there have been a few. Vioxx is probably the best known one. It was recalled. There's still ongoing lawsuits about that with cardiovascular complications. We've all been notified as GPs to be aware that the rotavirus which they produce can cause intestinal obstruction in babies. And just this year, in February, I think it might have been January, we all received a letter saying that Merck had been disciplined for falsely representing claims about one of their drugs called Vytorin.
And why has Gardasil been fast-tracked in Australia and approved?
Most fast-tracked vaccines are fast-tracked because there is an urgent need for it and because there's no alternative treatment or management program that could deal with the problem. Fast-track vaccines, 1 in 3 to 1 in 5, are actually withdrawn from the market due to adverse reactions. Considering that the pap smear program in Australia had already reduced cervical cancer by about 70% and was continuing to do so, It's hard to be definitive and hard to really understand the reasons for introducing a universal vaccination program. I actually started with the rat studies, and I went looking to see what the female rat ovary looked like after vaccination. I couldn't find out. So I contacted the Therapeutic Goods Administration and I put the question to them, and they said that it would require a Freedom of Information request to obtain that. When finally that information came through, the female rats that had been vaccinated were actually killed after their first litter. So we don't know how many more litters they may or may not have been able to have in their lifespan. We don't know when they would have gone through menopause. And we also don't know how many pups, they're called pups, would have been in each litter after that. Similarly, the human studies that have been done prior to the release of the vaccine, which were looked at by the Food and Drug Authority in America and by our Therapeutic Goods Administration, also failed to look at any effects on human fertility, on ovarian capacity, ovarian function, failed to discriminate between those women who were and were not on the pill.
How much cervical cancer can an HPV vaccine prevent?
There's no studies yet done that can answer that question. We are still reaping the benefits of the continuing and ongoing pap smear program, and of course that is preventing 70% of cervical cancer, and that figure is improving all the time.
So can parents have their children opt out of having this vaccine?
The school is not authorised to vaccinate any child against HPV without the parent's written consent. As a GP, and having read what's available in terms of the research on Gardasil and what isn't available, I personally don't think there's enough information in the government handouts for any parent to give a valid informed consent regarding Gardasil.
Where can parents find more information about Gardasil?
We need to almost do our own research. We need to go on to the internet. We need to read what's happening in other countries. You can also write to the TGA, the Therapeutic Goods Administration, and ask them, are there many girls, do you know, or have you done any studies, or are you planning any studies, to see if girls are developing menstrual irregularities or difficulties following the Gardasil vaccination. Because at the moment, we don't know a lot of the answers to those questions.